Have you or a loved one been recently diagnosed with a food allergy? It can feel overwhelming, I know, but you're not alone. In this episode, we're breaking down what's happening inside the body during an allergic reaction, what those reactions look like, how to stay safe, and why you should not be afraid to use epinephrine. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank Genentech and Aquestive for sponsoring today's episode. While they support the show, all opinions are our own and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's build that foundation together.
You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology. To continue with our Ages and Stages series, we are tackling the basics. So we're just going to give a broad foundation, and then we're going to go into more specifics for every age group up to 21 in the next 4 episodes. So today, we're laying that foundation for you. A new diagnosis, because this is what this episode is really for, is people with new diagnoses. A new diagnosis can really feel like a lot for people. And we want to give you a great place to start your journey with your food allergy, and you feel more confident in going forward. So Dr. G, let's build the foundation. What happens to cause a food allergic reaction, and why is our immune system freaking out?
Yeah, so a food allergy happens when the immune system mistakenly thinks that a food protein or an allergen is harmful, and it fires off chemicals called histamine. So histamine is a chemical that causes all the different symptoms of food allergy. First, all foods are made of proteins. When someone is allergic, their body remembers the food protein that they are allergic to, and a cell called an IgE will remember that food protein as something that it did not like. When someone is allergic and the IgE cells in that person's body sees that protein, then it links up with that protein and it causes the release of that chemical called histamine. During an IgE-mediated food allergy, a bunch of that chemical called histamine is released. And that can create symptoms in the skin like hives and swelling. In the airways or the lungs, it can cause wheezing, coughing, shortness of breath, and chest tightness. And then the gut, it can lead to nausea, vomiting, diarrhea, and all of these symptoms. And then it can also affect the heart, and it can cause the heart to stop beating essentially, and can cause something called hypotension or low blood pressure. So all of those symptoms put together can lead to a severe reaction called anaphylaxis, which can be life-threatening.
I know that we did a really great episode about the science behind an allergic reaction. So if you want a deeper dive on what's really going on in the body from cells to cells, then check that out. I'll link it in the show notes. But I think that set a really good foundation for where we're going to go from here. In my own experience, I have had reactions happen right away or after a few minutes. And I'm just curious, is this variation normal? Like, how fast can a reaction hit?
That's a great question. So reactions usually occur within minutes and usually no more than 30 minutes. But some reactions can take up to 2 hours after the exposure. And that's one of the key things about IgE-mediated food allergies is that it happens very closely linked to the exposure to the food.
Does the amount of time that a reaction happened depend on how much of the allergen you've eaten?
So in general, each reaction can look different. One time you might have eaten a small amount and had a huge reaction. The other time you could have eaten a little bit more and had a milder reaction. And so there's a lot of factors that go into what a reaction might look like and how quickly it occurs. So the amount that you eat can definitely change your reaction. How your body is feeling before a reaction can also affect the way that you react. So if you're sick, if you're not well rested, and then you're exposed to the food, your immune system might react even more than it did in other situations. So really, there's a whole host of factors that can change the way that your body might react to the food at any given time. So that's really why we recommend complete avoidance of your food allergen. If you didn't really react with a trace amount of exposure one time, you might react the next time because of the general state of your body. So we don't want you to take any chances.
Yeah, that's the thing about food allergies. At least that's how I feel. It's never black and white when it comes to what may happen because of what you just mentioned, right? There's so many factors to it. So it's important to really have a clear, non-negotiable way of how you manage your food allergies, which is strict avoidance, and knowing how to treat the symptoms if they occur, right? And this way, if the reaction is immediate or if it happens a little time after, you know what to do. So we did mention strict avoidance, and I am curious because we've heard a lot about omalizumab, which is Xolair, or OIT for food allergies. I'm curious how those play into food allergy management.
Yes. So now we do have other options to consider in addition to avoidance. So omalizumab is an injectable medication, which is a biologic medication, and it's approved for reducing allergic reactions in people with IgE mediated food allergies. So I keep saying IgE mediated, and that's related to the way that the body responds to a food allergen. So it's that cell, IgE, that causes the whole reaction to occur. So that's why we use the term IgE mediated food allergy. I just wanted to stop there because I knew that we kept using it and I wanted to make sure people were following. So the way that omalizumab works is it blocks the IgE antibodies that trigger an allergic reaction, which then reduces the risk of anaphylaxis and other allergic symptoms. So omalizumab is not a cure, but it can increase the tolerance to the food that you're allergic to and improve the quality of life for some patients. So you might hear a term called threshold. So it's essentially, it increases the amount of food that your body would need in order to have the reaction. So if you were reacting every time with just a small amount of food, with omalizumab in your system, that small amount would be increased. And so you shouldn't be reacting as frequently. So whether or not you want to be on omalizumab is a larger discussion. And we did have an episode that reviewed omalizumab and oral immunotherapy in more detail, but that's just a quick overview of omalizumab.
Okay, so basically what you're saying is that omalizumab is a safety buffer around the food allergen. It's not a cure and it's not going to make you not allergic to something, right? And if you're on omalizumab, do you still need to always carry your epi with you?
Yes, the recommendation is still strict avoidance, even if you're on omalizumab, and you need to carry your epinephrine device at all times. So as you said, it's not a cure. It just makes you less reactive in situations where cross-contamination might happen, like going to restaurants or going to someone's house, things like that.
So you mentioned oral immunotherapy, which is OIT, and this is a huge subject as well. So let's not go into the details, but let's just have an overview of what OIT is and why someone might consider that for their food allergy management plan.
Yeah, so oral immunotherapy involves gradually eating small amounts of your allergen to build tolerance and potentially prevent severe reactions. So the goal here also is to increase the threshold and to increase the amount of allergen you can safely consume, which provides protection against accidental exposure. So OIT requires daily maintenance doses to be effective, and not all allergists offer it due to the intensive protocols that are involved in making sure that the patients can get up to a certain amount. So again, this is not a cure. And even with oral immunotherapy, you need to carry around your epinephrine device. And of course, in oral immunotherapy, you're not practicing strict avoidance because according to wherever you are in the protocol, you will be eating a certain amount of your allergen to keep that tolerance active.
Okay, so basically with both omalizumab and OIT, it's not making you not allergic and you still have to more or less continue avoiding your allergen, but it does give you peace of mind from having a reaction if you do have cross-contamination or something like that. So we've talked about epinephrine a lot. I think we have to talk about why it's so important in the world of food allergy.
Absolutely. So epinephrine is the only medicine to quickly stop a severe allergic reaction, which again is called anaphylaxis. So it works to do a bunch of things in the body to reverse the reaction that the histamine causes. So it allows the muscles to open up around the airways and allows the person to start breathing again. It helps the heart beat properly. It reduces the swelling. It takes away the hives, and it basically helps your body return to normal when you're having a serious allergic reaction. So we use the phrase epi first, epi fast, because it is again the only medicine that will stop a food allergy reaction once it's started. And the earlier you use the epinephrine, the better. So once the histamine starts working and it causes that swelling, the inflammation, and all of those negative effects in the body, if we use it too late, then those effects are not really reversible, and the body has already gone into a state where we can't reverse the effects. So it's very important to use the epinephrine as quickly as possible if there is a food allergy reaction.
There's a lot of fear of using epinephrine, and the one way to really overcome this fear is to think about how if you don't really use it right away, things can get bad. So remember, use it fast or else you can get into some big trouble. We're in an exciting time because I was only able to use an auto-injector for very long in my life with food allergies, and now there are more ways than just an epinephrine auto-injector. So Dr. G, can you tell us about the ways that you can now administer epinephrine?
Yes. So now we have essentially two different forms of epinephrine. There's the injectable form, and that comes in lots of different devices. But essentially, the medication goes through a needle into the muscle and into your body. And then there's also a new nasal form of epinephrine where you can just spray the epinephrine in your nose, and it also works effectively. So now we do have choices, and it's important to have that discussion with your provider on figuring out which form of epinephrine is approved depending on your child's age. And then also it can depend on which medication is covered by your insurance. So whatever device you get, you will have a training device that you can use that helps everyone around you, around your child, practice how to use the medication, because practicing really is so important. Because when you're in an emergency situation, you really want to feel comfortable with how you use the medication.
I totally agree. Practicing is so important. What's interesting is that I've never gotten a trainer before, but I have practiced with old auto injectors in an orange, which is a lot of fun. If you have any lying around, just make sure you dispose of them safely, because you get the feel of what's going to happen. So the mystery of using an auto injector or a nasal spray is gone, right? And when it's not mysterious anymore, it's not as scary. And I think, again, like I said, people are scared to use epinephrine, but it's so important that we do.
Wow, Kortney, that's interesting that you've lived in Canada, you've lived in Germany, and you've never gotten an epinephrine trainer. So that's really interesting to know. It must be something that the FDA or the regulatory body that approves medications in the US forces companies to do here. But I actually think that that's one of the most important things. And I'm glad that we are doing it because, again, practicing is super important. And these devices can feel overwhelming when you haven't had any practice in an emergency situation. And that brings me to another important point. One of the hardest things about having a new food allergy diagnosis is remembering that you need to carry your epinephrine device with you at all times. So this is something that most people have a hard time getting used to doing, but it is the number one thing that we need to remember with a new food allergy diagnosis, because if you don't have your epinephrine with you, you can't use it quickly.
Yeah, carrying your epinephrine is so important, and it can be tricky, right? I have 3+ decades of experience of doing this. So maybe I'll just share a couple of tips that I have, both for where you want to keep it at home and just carrying it for yourself. My number one tip is to have a dedicated spot for your epinephrine at home. I have 2 devices that I swap between my purse and my knapsack or whatever when I'm leaving the house. But when I'm at home, my epinephrine is always in the same spot, which means that my purse always hangs on one specific door and it's easily accessible. So my husband knows where it is and I know where it is. If you don't have a purse that you want to have it hanging in, like for instance, you have a child who has their devices, we had a dedicated basket at the front of the house that we always put the devices in. So it went from my backpack to the basket and then back to my backpack in the morning when I was off to school. So that's my tip for you, is have a dedicated spot that you're very consequent about using. It's just one thing you have to get used to, is that you cannot skip putting it in its place, because if there is an emergency, you don't want to be scrambling to find it. The second big tip I have is that get something you love to carry your epinephrine. And what I mean by that is get a bag that you like so that you always have it with you. I know when I first had to start carrying epinephrine on my own, my mom made a big date of it and we got a purse that I loved. So, I was an 11-year-old who got to choose her purse, and I felt so confident and so pretty and so excited to have this purse on me that I was happy to always have my epinephrine on me, right? So make it joyful. I know that there are a lot of companies that make really awesome epinephrine device carrying bags that are also cooled. So, if you're going out in the summer, you have it at a good temperature. And then the last thing is, like I said, tell people where your epinephrine is stored. My husband knows where my epinephrine is at all times. My family knows it's always going to be in my purse, so that if anything happens and you aren't able to do it yourself, no one's scrambling to find it. It's there and it's easy to access.
Thanks so much, Kortney, for sharing your tips. Your epinephrine device is the most important aspect of staying safe with a food allergy, no matter where you are.
Yeah, it's kind of like, think about your epi like your phone, right? You really don't leave the house without it. I feel like that's a perfect thing to compare it to, since we're all addicted and attached to our phones. Let's just be the same way with our epinephrine. Now, let's talk about antihistamines, since we're talking about treating anaphylaxis. Sometimes people think they are enough to treat an allergic reaction and they don't need to use their epinephrine. Dr. G, can you tell us more about antihistamines? Good, bad, confusing?
It is confusing because the word antihistamine makes it feel like, well, if this is caused by a histamine reaction, I can just use an antihistamine for something like anaphylaxis. Well, as I discussed, anaphylaxis is a severe reaction and a lot of histamine is being released during that particular type of reaction. And things like Benadryl, which is a commonly used antihistamine or was a commonly used antihistamine, or cetirizine, which is Zyrtec, or fexofenadine, which is Allegra, or Claritin, which is loratadine. All of these things may help with itchy skin or a runny nose during seasonal allergies, but they are not strong enough to stop anaphylaxis. That is just a whole different type of reaction that needs to be reversed in a different way. Antihistamines work too slowly. They don't treat the breathing trouble or severe swelling that anaphylaxis can cause. So epinephrine is, again, the only medicine that is strong enough and fast enough for serious allergic reactions. And unfortunately, people who have had bad outcomes from food allergy reactions often have delayed using their epinephrine device because they're waiting for an antihistamine to work. So again, antihistamines will not help in a true food allergic reaction.
Like you said, Dr. G, epi first, epi fast when it is a food allergic reaction. Antihistamines are great for seasonal allergies, but not for a food allergic reaction. Now that we know where you're going to use epi, what are the symptoms that we're going to be looking out for?
So the only thing that I want to clarify with the antihistamine is that if, for example, the food wasn't ingested and it was just touched and the person may get hives in the area that the food touched their body, then for those kind of reactions, you can use an antihistamine to take care of that reaction. And now what I'm going to go into is what are the symptoms where you know that it is true anaphylaxis and an antihistamine won't work. So the general rule is that if any combination of two systems are involved, then you need to use your epinephrine device. And what we mean by that is the skin and lungs. So if you have hives and are having trouble breathing, like coughing, wheezing, or shortness of breath, or if you have skin and gut symptoms, so you have hives and then you're vomiting and have diarrhea, or if you have lung and gut. So any kind of combination of two areas of your body that are involved, or if one system is progressing really rapidly. So you had one hive and now you're just covered in hives within seconds. That means that the reaction is progressing quickly and you should also use your epinephrine device. Or if you're having only trouble breathing, coughing, wheezing, shortness of breath, then you can also use your epinephrine device. Really, in any moment where you feel that the symptoms are going quickly, you can use the epinephrine. But if it's confusing and nuanced, if you have two systems involved, you're using your epinephrine device.
And if you are really unsure, is it better to just use epi than to not use it?
Absolutely. So the important thing to remember is that epinephrine is a very safe medication. So we have a great episode with Dr. Golden, who is one of the people that's done a lot of research on epinephrine. And we talk about what is anaphylaxis, when to use epinephrine. It's episode 59 if you want to learn more. But to summarize what we discussed on the safety of epinephrine, really the side effects are the normal reaction of the body to get the body back to where it needs to be, and they are not dangerous. So you will feel an increased heart rate, feeling like your heart is racing. That means that the epinephrine is working, and that means it's getting our heart to beat again, which is super important. Your blood pressure will go back to normal, which can sometimes lead to a headache. And then you may have shakiness or jitteriness from the medication working, or some nausea. All of these things are side effects that show us that the medication is doing what it needs to, but none of them are dangerous. So not treating anaphylaxis is more dangerous to the body than epinephrine ever would be. And before, it was only an injectable medication, which injectable medications can feel overwhelming. But now maybe with the nasal epinephrine, people are having an easier time using it rather than not. But again, both forms of epinephrine are great and can help with an allergic reaction.
As a proud epinephrine carrier, that episode was so interesting for me, and I learned so much more, and I feel so much more confident about using epinephrine, so I would definitely check it out. I like to say it was a golden episode with Dr. Golden. That's how much I loved it. Dr. G, one more symptom I would like to ask about, and you hear about this actually quite often, is something called the impending sense of doom. Would that count as a system, and maybe can you clarify what that is?
Yeah, so that is actually a subjective feeling. When we talk about subjective feelings, that means that that's something that the person is feeling that we can't objectively measure, meaning I can't tell you if you're feeling it or not by using my stethoscope or by looking at your blood pressure or anything like that. It's just a feeling that you're having, and it's a sense of unease or feeling that something bad is happening to your body. And this goes back to that whole point where if you're feeling like things are not going in the right direction, it is better to use your epinephrine device than not to use it. And the one thing that I want to mention, however, is that if you have used your epinephrine, what do you do next? So we used to say that everyone that uses their epinephrine needs to go to the ER or call 911 whenever they use their epinephrine device. But during the COVID-19 pandemic, we learned that this wasn't always necessary, because during that time, we really didn't want to go to the emergency room or call 911 because of the pandemic and the serious nature of what was happening. So now the recommendation from the 2023 guidelines that were reissued suggests that in some situations, if a reaction is treated very early, which is called early anaphylaxis, and the symptoms resolve completely after you give the epinephrine, and you have two epinephrine auto injectors or two nasal devices at home, that you may not always need to call 911. So again, 911 isn't required simply because epinephrine was used. Instead, it really should be thought of as, do I need further support? Do I need somebody to come to me with an ambulance that has oxygen, that has more epinephrine, that can support me in feeling better? And if the answer is no, I'm actually basically 99% back to where I was, and I do have another epinephrine device in case things get worse again, then you don't need to call 911 and you don't need to go to the ER immediately. But of course, if you feel at any point during the reaction that you're not doing better, then you can call 911 and get emergency services there to help you and support you further.
Thank you for clarifying that, Dr. G. I think that's a really important point. Honestly, as a teenager, I wasn't afraid of needles. I was afraid of going to the hospital. So I think that that's a really nice new guideline that they have. It makes people feel even more confident, hopefully, to use their epinephrine. So you did mention that you should have 2, and if you have 2, maybe you don't need to call the ambulance if everything's getting better. Why do we say that we need to carry 2 epinephrine devices?
So we recommend carrying 2 epinephrine devices because sometimes the reaction doesn't just respond to 1 dose of the epinephrine, and you may need a second dose. So we want the person to be prepared with that second dose if the symptoms continue to progress and worsen and things aren't better. In addition, if you use that first dose incorrectly, so if for whatever reason the instructions weren't followed, you didn't hold the injectable epinephrine to the thigh for the 5 to 10 seconds that are necessary, depending on which device you're using, then you would need another epinephrine device. It just gives you that extra cushion of having a second device if you need it for the reaction, or having a second device if something goes wrong with the first device.
So now we know about the best way to manage food allergies and what to do when you're experiencing a reaction. I know that as much as we feel like we can be prepared, sometimes in a stressful situation, we just blank, right? You just hit a wall and you have no idea what to do. What do you do, Dr. G, to help your patients really feel confident about knowing the next steps if a reaction occurs?
Yes. So a lot of healthcare providers are using what's called a food allergy action plan. And this is something that gives you and those around you a clear plan of what to do if there are symptoms consistent with a food allergy exposure. So it lists the allergens that the person is allergic to. And then also it lists the symptoms of when to inject epinephrine and when to call 911 plus emergency contacts. So you can post a copy on the refrigerator. You can stash that in backpacks, in glove compartments, and you can save a picture on your phone for easy access so that you can send it to people easily or you can get to it easily during a reaction.
A lot of managing food allergies is kind of asking other people to help you stay safe because you know that food is everywhere. So having an action plan is actually a great conversation starter and a way to explain to people why you might need certain accommodations. And since it's coming from a doctor, it might make the conversation feel more grounded in science and reality. So sometimes I think that having this tool is a great way to break the ice when someone's not fully understanding why you're asking for a certain accommodation.
Another topic that's frequently asked about is if the home should be allergen free or not. And this is something that we'll actually get into with the different episodes that we have planned. So we're going to go into the different ages, have different nuances that we need to think about, right? So if you're diagnosed with a food allergy from 0 to 5, that looks different than somebody that's 18, right? And so we're going to talk about all of those nuances, but essentially whether or not your house should be allergen free or not is something that really needs to be discussed. The family rules should be that hand washing before and after meals and no food outside the kitchen and no utensil sharing. Those are some ground rules that you can set in any household just to make it safer for the person with food allergy.
Yeah, that's a great point. And that's definitely something that has evolved in my house. We started as a totally allergen-free house. And I'm talking about me and my husband. We started as a completely allergen-free house, but now we have most of my allergens in the house, except for like 1 or 2 that are just so messy. It just makes me nervous because I love him, but I don't totally trust his cleaning skills sometimes. But we do have rules in place and he knows what to do to clean everything and what to do to make me feel safe, but also to make him feel safe when he's eating my allergens so that he doesn't feel like, he's accidentally exposed me to an allergen when he definitely didn't mean to. So it's also about discussing what the person or the people in your household feel comfortable doing to keep you safe. I think that's a big thing. It's a conversation for everyone, not just for the person who has the food allergies. And one other big challenge that we face is buying food, right? And understanding and reading those labels. And I know that this is a huge subject. We're going to do a whole episode on it this year. So get prepared for that. It's going to be exciting. But Dr. G, can you give us a really quick Coles Notes version of what food allergy labeling how to navigate that? What is that all about?
Yeah, I think the key thing to remember is that you have to read labels every single time. So what I've learned from the last 20 years of being an allergist, actually from patients, is that companies can change the ingredients without changing their branding, without changing the packaging. All of a sudden, the ingredients can change. And so that's really an important thing to remember. And so reading labels every time is super important when you have an allergy. And technically, the top 9 allergens, milk, eggs, peanuts, tree nuts, fish, shellfish, wheat, soy, and sesame, need to be clearly labeled, at least in the US. But there are things like may contain or processed in a facility with, which are voluntarily put on the labels, and they are harder to navigate. So we'll talk about this topic also as it pertains to the different ages, because whether or not to eat a may contain food or processed in a facility with also is a nuanced topic that can depend on the age and also depend on the severity of the allergy. So that's also something that I think you should have a quick conversation with your healthcare provider about in order to really figure out what's right for you and your family.
Yeah, nothing goes in this body without having a label being read. That's like a strict rule for me is if I don't know what's in this food, if I have not read the label, I am not going to eat it. So I think that's a really important thing to mention. So we're getting to the end of this episode, and I feel like we have to talk about one more thing. And that is the fact that getting a food allergy diagnosis can feel totally life-changing. Something that you loved or something that you had imagined sharing with your child might just be completely taken away from you. And it feels scary. It feels overwhelming. You feel anxiety. You feel burnout because honestly, reading labels and grocery shopping going from 5 minutes to 20 minutes is exhausting at times, right? These things kind of pile up. And you also feel alone a lot of times because you feel like this journey is one that you're going on by yourself and no one understands it. So Dr. G, mental health. How do you navigate this with your patients as a part of living with food allergies?
Yeah, so as you mentioned, feeling overwhelmed or stressed with a new food allergy diagnosis is totally normal. I think that the important thing to remember, and that's why we're trying to put together this series, is that the more knowledge you have around any chronic condition really can help you feel more empowered and less scared, hopefully. And that's really one of the important things that I always emphasize with families is to use reputable resources like the Allergy and Asthma Network, the American Academy of Allergy, Asthma, and Immunology, the American College of Allergy, Asthma, and Immunology, FAIR, AFA. All of these support groups can really help in managing the anxiety and creating a community around your diagnosis. But if the stress and anxiety are getting overwhelming, then one of the things that I'll do is refer to a therapist or a psychologist that can really help manage those feelings and can help the person talk about how they can better deal with their new diagnosis or with their family member's new diagnosis. And that's really important because especially for children, the stress that we carry can then seep into their life and into that diagnosis for them. And so we really want to be sure that we're managing that stress appropriately so that we don't create that stress for our child.
Yeah, and there are actually therapists now who are specialized in food allergy. So I can link some of those too, because that's an interesting resource for people who are already there and they want that. So we've discussed a lot today, and I think this really does set a good foundation for people who are newly diagnosed who are just looking at what the next steps are for them and how they're going to tackle this new food allergy life. And next episode that we're doing is going to be tackling food allergies from ages 0 to 5. Subscribe if you are excited to learn about ages and stages so you don't miss the next episode in your inbox.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.theitchpodcast.com. itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.